Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG platform, and if my $1,000,000 voice is audible to everyone, please put a like in the comment section. Not a like, you can just put a comment section that my voice is audible to everyone. And it's a beautiful class where we're going to talk about the second half of the celiac disease. One of the very important topics, celiac disease, we have covered in a very simple and a very smart way. So like that only, we're going to cover everything possible on this planet. All I need is that fix a topic and let's have a beautiful class. My name is Dr. Anand, assistant professor in a college, in a beautiful medical college, and let's start the class. If is my voice audible to everyone, let me know. On this session, I hope you guys have already given we have this amazing beautiful test basically happening, like which happened yesterday on April 17th 9 a.m. NEET PG 2022 all India mock test, which basically happened recently. I hope you guys have given that. Is my voice audible to everyone? Yes or no? Then I'm gonna start the class. Thank you so much. And amazingly, you guys are studying. I hope you will really get a very good seat in the exams. The exam is very near, so that's amazing. And yes, my voice is coming. Yes, audible. Perfect. It's 11:31. I will finish the class on the Unacademy NEET PG platform. This is the week 4th of the April, where from April 18 to April 24 we have this beautiful test basically gonna happen for everyone. I want you guys to attend as many tests as possible of anatomy, biochem, all the amazing tests we have. Also at the same time in the Unacademy we have something known as plus subscription, something known as iconic subscription. In the plus subscription, amazing access to live and recorded classes, educators are good, content is really nice, so it's a plus subscription. Whereas the iconic subscription, you get the Unacademy platform as well as the prep ladder subscription. All the clinical notes, video lectures, questions bank, rapid revision, everything you get on the our amazing iconic subscription. So, and also this is a new one for the new people, new candidates. We have something known as Unacademy Lite. So we have this some 90 plus grand tests for the PG, INI, CT, FMG grand test series with previous year question papers, of course. So this is amazing basically with the previous year question papers and top series curated by the top educators. Unacademy Lite, very small and cute plan because the exam is just around the corner. It will be nice for the MBBS Prof 1. We for pertaining to the next, we have a batch from April 20th, 3 months, 6 months, 12 months. These are the prices, and pre-launch price is this one. So this is a very beautiful MBBS Prof 1. It's actually locked. If you use the code Dr. Anand, it will unlock it. Okay, so it will be easy for you. Yes, is my voice coming? मैं भी शेव करा के आया हूँ. Okay, thank you. And also we have this daily practice papers every day on the Unacademy app. I'm putting a lot of amazing daily practice papers, topic wise question, beautifully with 5 to 10 MCQs in every live class. So I hope you guys are giving that. And doubt clarification batch from April 6th to May 16th, basically subject wise clarification in a very beautiful manner for the upcoming exams. It's nice, it's very good. And that's it. Congratulations to the amazing toppers who work really hard, deserve to be on this podium. And now I want Osama, Vandit, Zainab, and we have this what you call Pancake, and some amazing people. I want your names to be there. If you're a newcomer, download Unacademy, where we have this amazing special class features where we make a lot of MCQs poll. You can ask me any doubt. You never miss the classes because all the lectures are recorded, right? That's it. So I've told you regarding the FMG high yield revision MCQ batch, and also I have told you about the plus iconic and light rahe, sundar sa pack le, khush rahe. So light subscription. That's it. Let's start the beautiful session. Yes, we're gonna talk about the second half of the celiac disease. This class will exactly get over by 11:30. Short and sweet 20-25 minutes class, so that you have the best attention. Before starting any amazing segment, we always have a motivating quote, and this quote says, inner peace. Inner peace is the new success. Inner peace is the new success. I know you're studying very well. I know you're working so hard. There's no doubt about it. But have an inner peace also inside. Because if you don't have an inner peace, so much of hard work is of no use. You must have some inner peace. And as someone beautifully said, success is not the key to happiness. Getting a rank or getting a seat or getting a new house, success is not that. Success is not the key to happiness. Happiness is the key to success. If you're happy in your daily routine, what is successful? What is the meaning of successful? What do you think? Having a BMW is successful? Having a 5-story building house is successful? Having a land of your own, is that successful? No. If you're happy in your daily routine, that is successful. If you're happy in the morning, if you're happy with the work, if you're happy, like I am very happy with my daily routine every day. Like, I was telling my junior, today is vacation. There's a song on this, you might be knowing. Today is vacation. Why today is vacation? Today is vacation because I love my occupation. Today is vacation because I love my occupation. So whenever I go to hospital, I don't go with a face like that, oh my god, I have to go to hospital, oh my god, life is so stressful. No, today's hospital. It's a vacation. I wanted to be a pediatrician. I am a pediatrician. I'm a child specialist. So I wanted to be that, and I am that. So what's wrong in that, right? Today is vacation because I love my occupation. इस सोच से जाएंगे तो थोड़ा सड़ा हुआ मुंह थोड़ा ठीक हो जाएगा, ठीक है? Thank you so much. So yes, let's start the beautiful class. Divya, Ansav, and amazing people we have. They were there with us at 9 p.m. session also. Celiac disease, let's cover it up in a very beautiful way. Only I want your 22 minutes. That's it. Celiac disease, we've spoken about. It is a disease of G and G. That is nothing but genes and grains. Genes which are responsible are HLA class 2, and the grains which are responsible are gluten. And also we covered that we have this variant of HLA genes in celiac disease. Variant are of the HLA DQ2 and HLA DQ8. That also we covered, right? Then also in the class we understood that the three important hallmarks are important because they basically attack on our small intestine. So villus atrophy, crypt hyperplasia, and increase in IELs, intraepithelial lymphocytes, is what we see in a case of celiac disease. Then also we understood the patient is sensitive to gluten. So gluten is there in the wheat, in the rotis, in the cake, in the pancake, not the pancake, क्या बोलते हैं इसको, क्या छोटे वाले क्या बोलते हैं, pastry. Pastries, right? Then bread, pancake, sandwich, hot dog, pizza, and all those places we spoke about it. The patient will be very allergic and sensitive to gluten. Also in the clinical features we understood that I'm sensitive, like I have this typical features and atypical features. In the typical features we spoke that I'm having some small intestine issue, maybe I'll have vomiting, or maybe I will have diarrhea. I can also have constipation, and I can add so much of diarrhea and vomiting, definitely I will not grow the weight and height. So I'll have failure to thrive, right? And also I can have tenesmus, that is nothing but pain while passing through, or I would say incomplete evacuation of bowel, not bladder, bowel. Okay, that's what. Then also we understood that what you called the which is more common, Osama will tell, is it in intestinal manifestations are more common, or extra in manifestation are more important? Extra intestinal manifestations are something which is seen in a case of celiac disease. This much we had spoken in our beautiful previous class. I hope you guys have got it. Yeah, the various, now this is an important slide. The various extra intestinal manifestations in a case of celiac disease are: number one, can anyone please put a comment? What do you think, if you're a newcomer, you don't know what is this, like what does it look like? Does it look like a macule or a papule, or what it does look like to you exactly? So this is nothing but, can we say that this is intense itchy blisters filled with water? So these ये मोटे मोटे क्या हैं? These are like blisters, okay? These are intense, these are itchy, these are blisters filled with water, number one. So this condition is known as, what do you call this exactly? So Samir, this is known as dermatitis herpetiformis. Very, very, very important, one of the extra intestinal, because this remember this this HLA variant, basically it is, kind of it is activating my T cells, and they are activating the cytokines, and basically they are activating the whole inflammatory process. So inflammatory process they're activating, so they are attacking on my immune system. Once they are attacking on my immune system, the skin problem basically I'm having is nothing but dermatitis herpetiformis, right? Number one, it's like a cluster of itchy bumps. Now photographic memory, please everyone, please focus on this photo. It's a cluster of itchy bumps, which looks like eczema. It could be looking like a acne, or it could look like a eczema. Which is the most common location, guys? What do you think? ये फोटो में क्या नजर आ रहा है? क्या है ये? Which is this area? Can I say this is the elbow? Can I say this is the knee joint? Yes or no? So the common areas responsible or present in a case of dermatitis herpetiformis are nothing but my elbows, my knees, my lower back. Elbow, knees, and lower back are the commonest areas involved in dermatitis herpetiformis. And remember, dermatitis herpetiformis is one of the extra intestinal manifestations, skin manifestation of celiac disease. Yes, yeah, exactly. So nicely, Elsie and Samir is answering. Very good, dear, very good. And also, what can we appreciate in this picture? Basically, they're attacking my teeth also. Can I say enamel hypoplasia or malocclusion or malalignment plus hypoplasia basically of the teeth? Also, exactly, it's a very nice question, very nice point. You know, we all know that the most common extra intestinal manifestation of celiac disease is nothing but iron deficiency anemia. And very important, now the PG question will come. A newborn baby not gaining weight, not gaining height, having alternative constipation and diarrhea. So one question can happen that the most common extra intestinal problem this baby can have is iron deficiency anemia, but very important, resistant to oral iron therapy. So can we therefore have a continuation of the question? The lab investigation of this baby who was having constipation and diarrhea and weight and height issues, the lab investigation of this baby was having microcytic hypochromic anemia, and iron deficiency anemia was diagnosed, and the patient was given oral iron therapy, and still the patient was not improving. So can you allow this new information in your brains that the patient will have iron deficiency anemia, he will be given iron therapy and he will be resistant, because naturally the problem is not the problem will not solve if you give just iron, because the problem is the constipation, the problem is the diarrhea, the problem is there in my duodenum and in my small intestine. Are you understanding? Yes or no? Yes, exactly. Yeah. So Dr. Giri says, hi sir, just finish your first part of celiac. So how was it, Dr. Giri, the first part of celiac? Did you learn something or nothing? Okay. Great. So can we understand this? The patient was on oral iron therapy. The patient did not respond to oral iron therapy, and that's again, you must think of celiac disease in your busy OPD also. किसी patient को iron आपने लिखा है, if you have given iron to a patient, after usually iron treatment is given 4 to 6 months. After 3-4 months the patient has come, still there is no improvement in iron. So you must get a TTG done. You must get a TTG done. Guess what is TTG? And can you tell me what is TTG? TTG is trans anti-tissue transglutaminase. So we have nothing but transglutaminase. Just in general, you should know, like a take-home message, that the TTG levels will be elevated in a case of celiac disease. Anti-tissue transglutaminase, we write it basically exactly. So tissue transglutaminase is something, TTG levels will be elevated in a case of celiac disease, that you should know exactly. Samir says iron overload in these patient complication. Iron overload, no bro, they, like, the patient will have diarrhea, constipation. Diarrhea means whatever iron you're giving, it's going out. Diarrhea you're giving, it's going out, it's not getting absorbed. Why it's not getting absorbed? Because the problem is not the iron, the problem is in my duodenum. So where the iron usually get absorbed? Anyone where the iron gets absorbed? Divya says to Kamal, I'm preparing for not set, not PG. Cool. So where does the iron get absorbed? Do you remember, right? Yes or no? This one, क्या बोलते हैं उसको? Indian Federation of Bank, IFB was the mnemonic. So we have iron, we have folic acid, and we have B12. So can you say duodenum? And then we have the jejunum, and then we have the ileum. So iron is absorbed in duodenum, jejunum, folic acid is absorbed in jejunum, and vitamin B12 is absorbed in ileum. Duodenum, jejunum, ileum. IFB, Indian Federation of Bank. Please put a like button to this video. Have you understood this much of part? 15 minutes are over. Just exactly 15 minutes are left. I'm gonna finish this class. Actually, these small topics are really good actually. मतलब पता भी नहीं चलता, stress भी नहीं होता. Yes, exactly. Cool. Perfect. And also, as can we appreciate very important point, as see, link and study. Okay, don't cram. Link and study. Will the patient have diarrhea? Yes. Because will the patient have constipation? Yes. Will the patient have not gaining weight, not gaining height? Yes. So obviously, if the patient have not gaining weight, not gaining height, then can the patient have a case of short stature? So yes, 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 yes. The link, okay, link. A newborn, a baby mother says not gaining weight, not gaining height. On further evaluation, the patient was diagnosed with short stature. Like that, the MCQ. You yourself make the MCQ. Okay, connect yourself. Okay, and yeah, exactly. So how do you define short stature? Who will tell me? It's already an exam question. हाँ जी आगे आ जाओ. Exactly. Osama, Kamal, Arpita, Sameer, Elsie, how do you define short stature? Do we have a proper definition which has come in exams? Anyone? I will not tell. मैं नहीं बताऊंगा. जो करना है कर लो. मेरा मूड नहीं है बताने का. How do you define Sameer, Osama? Do we have a proper definition? Exactly. So height less than third centile. Height less than third centile. If I talk about centile, height less than third centile is short stature. It is also based on standard deviation also, but height percentile के हिसाब से it is less than third centile. We have some pennas who says less than minus 3 standard deviation. No dear, that will be a wrong answer. If I ask you what is microcephaly, then you will say okay, you will say what head circumference. Head circumference less than minus 3 standard deviation is known as microcephaly. Head circumference more than 2 standard deviation is macrocephaly, and height less than third centile is nothing but short stature. Short stature. Centile बोले तो centile, okay? That you should know. ठीक है, no problem. And also, as my immune system is getting affected, I will have in my joints, I will have arthritis. Also, I will have my bone will have a huge issue. Basically, I will have osteopenia, like खोखली हो जाएंगी bones, very the thickness of the bone will reduce. And the CNS problem, I can have ataxia and I can have epilepsis. So these are the important extra intestinal manifestations of celiac disease. I'll repeat again. The extra intestinal manifestation are more common. They are number one, in the skin, we have dermatitis herpetiformis. Then also we have something known as in the teeth, we have what you called enamel hypoplasia. Then also, of course, I'm having iron deficiency anemia resistant to oral iron therapy, undoubtedly. Like if you write this like proper thing, no, iron deficiency anemia resistant to oral iron therapy, well, examiner will be very happy that actually you have actually understood the topic, that way. So perfect. The patient will have short stature, the patient will have a delayed puberty, the patient in the joints will have arthritis, the patient will have osteopenia, and the patient will have CNS involvement like nothing but ataxia or epilepsy. Next, which is the most common, अच्छा this part we have already done. Diabetes mellitus associated होता है but थोड़ा नीचे less likely होता है पर होता है. So ये तो पता ही है, we know this question now, which is the most common extra intestinal manifestation of celiac disease. The answer is iron deficiency anemia. And also there is gluten sensitivity. We know that. Again, see, that's what, can we please therefore have another MCQ question number 7, that which is the most common type of chronic diarrhea in children? Such a beautiful question. Which is the most, we know, the various types of diarrhea, right? We have acute diarrhea, we have persistent diarrhea, and then we have chronic. I have diarrhea from 6 months, I have diarrhea from 2 years, from since childhood I'm having. If I eat something suddenly, I'll get a diarrhea. In today in my OPD itself, in our during our rounds, we have a 2-year-old patient with acyanotic congenital heart VST with chronic diarrhea. So uska आज ही हमने TTG levels के लिए send किया. TTG क्या होता है? Anti-tissue, or you can say just tissue transglutaminase enzyme, tissue transglutaminase, which is elevated in a case of celiac disease. So the most common cause of chronic diarrhea in children is nothing but अपना what you call celiac disease. ठीक है, 10 more minutes, then this class is over. Very nice question. Will, like, I'm having diarrhea, will I have a small bowel diarrhea or a large bowel diarrhea? Will my small intestine will be involved or the large intestine? A or B? Put your answer in the comment section. If this is the NEET PG question, that, or you can say even the INI-CET question. So basically, yeah. So what do you think? Large bowel diarrhea or a small bowel? So Deepak, yes, beautifully answered by beautiful people. Small bowel diarrhea. Osama, Vandit Priya, Ansaf, Panchal, Hari, Krushan, and Doc Dom. Doc Dom. It's like knock knock. Knock knees. Genu, welcome. Okay. Small bowel diarrhea. Very good. And will is this line true or is this line false? Will the patient will have growth failure? Obviously, sir. Okay. After reading the whole topic, you can write a bio, you can write a PhD full bibliography on celiac disease. Next important point, of course, the patient can have an anemia, and iron deficiency anemia is very common. So perfect. Yeah. Now this is the exam question. PG entrance question number 8. If the examiner has to make the paper tough, then definitely he can ask you this question: which is the first serological testing done for celiac disease? Good question. Which is the first serological testing? Is TTG better investigation? What is TTG? Tissue transglutaminase. Tissue transglutaminase. What is EMA? EMA is nothing but endomysial antibodies. EMA is nothing but endomysial antibodies. So what do you think, guys? A, B, or C? Which is the? I'm suffering from celiac. Like I'm suspecting celiac in my patient. Which is the first investigation I should send? The best answer already given by Deepak. Deepak कह रहा है all. शादी में all कितनी महंगी जांचें होती हैं, all तेरे को मिल मुझे बाहर तू. So yes, हाँ चलेगा. Okay, so TTG is the best investigation. The first serological testing done for celiac disease is nothing but TTG. Please, my dear friends, it's a medicine topic as well as a pediatrics topic. Any patient comes to me in a busy OPD, if I'm suspecting chronic diarrhea, if I'm suspecting I give iron therapy, still patient not improving, mother says sometime he has constipation, sometime he has diarrhea, and I'm planning to send an investigation, TTG in our real OPD every day. अगर आता है celiac का I sent. So remember, you also, once you become MD pediatrics and MD what you called वो क्या बोलते हैं उसको, medicine, then you please write this. Okay, TTG भेजना है. Exactly. Next question. Yeah, beautiful question. Beautiful question. If the results of TTG is equivocal, if the results of TTG is equivocal, मतलब पता नहीं चल रहा, कभी almost normal था, थोड़ा ही बढ़ा था, little only elevated, not much actually. So the results of TTG is equivocal. Then what are you left with? Can you tell me? Do you want to do endomysial antibodies or deamidated gliadin peptide? What investigation will be nice? So Hanji, the best answer will be EMA. Now in that case, beautiful. It's a very beautiful question. If the result of TTG, tissue transglutaminase level, is kind of plus minus, then definitely endomysial antibodies is the investigation of choice. And the third question, if I'm a less than 2-year old, if I'm a less than 2-year old, then what is the investigation of choice? Then the investigation of choice will be C, deamidated gliadin peptide. So beautifully choreographed this whole slide. So if the first episode, like suspecting TTG best, TTG plus minus, then EMA best. If the child is less than 2 year, then DGP best, deamidated gliadin peptide. Next question. Now this is a flowchart, beautiful flowchart from our Piyush Gupta book, beautiful flowchart. So can we please have focus on this? Listen to this flowchart very carefully. Okay, 7 more minutes, then this class is over. The guidelines for diagnosis of symptomatic patient. A patient came to me with symptoms, okay, constipation, diarrhea, failure to thrive, anemia, iron deficiency anemia, not responding to iron therapy. Oh my God, short stature, delayed puberty. Oh, इतना कुछ exactly. Yeah. अर्पिता कह रही है शेव कर लिया सर ने, कैसी लग रही है मेरी स्किन? हाउ इज माई स्किन? इज इट ओके नाउ विद शेव और विदाउट शेव? प्लीज पुट आंसर इन द कमेंट सेक्शन. हाँ जी, आपको दीपक कह रहा है ऑल हो गया. हाँ जी हो गया, ऑल हो गया. आज खुश हो गया तू? अभी ऑल कर लिया मैंने, ठीक है. हाँ जी. सो द पेशेंट, इफ द पेशेंट हैज कम विद सिम्टम्स, सो ब्यूटीफुली पुट, दिस पॉइंट इज ब्यूटीफुल. प्लीज कैन वी फोकस जस्ट 10 more seconds. If the patient has come to me with symptoms, which is the first investigation I will get it done? TTG levels, and even IgA levels also you get it done. In some books they have given TTG and IgA. If the TTG is positive, tissue transglutaminase is positive, then of course, if the TTG is positive, then you have to see whether it is more than 10 times, positive from the from the upper limit of normal, or less than 10 times positive from the upper limit of normal. Very beautiful. Yes, Deepak is right. I'll repeat again. The patient was having symptom, TTG कराया मैंने, tissue transglutaminase. Negative आया तो means obviously I am not having celiac disease. अगर positive आया, if it is positive, then how much positive? Is it more than 10 times of the upper limit of normal, or less than 10 times? If more than 10 times TTG came, then the next investigation I would like to done is EMA and HLA. What is EMA? endomysial antibodies. EMA is nothing but endomysial antibodies. And what is HLA? Of course, everyone knows, human leukocyte antigen. You know, right? HLA DQ2 and HLA DQ8. Remember that thing, I'll get it done. So EMA and HLA, I will get it done if my TTG is more than 10 times of normal. If the EMA is also positive, endomysial antibodies, and HLA also is also positive, then obviously, then to bhaiya, done, I'm having celiac disease. If my endomysial antibodies is positive and HLA is negative, then you will get my biopsy done. Put your focus, everyone, this is important. Okay, let me revise again. The patient came with symptoms. I planned of doing a TTG, which I regularly do in my OPD. TTG negative, no, there is no celiac. TTG positive, how much positive? More than 10 times of normal or less than 10 times of normal? More than 10 times of normal. The second investigation I have is endomysial antibodies and HLA, human leukocyte antigen. If both are positive, obviously I'm having celiac disease. If EMA is positive but HLA is negative, then I think then there's a doubt, na? Then I'll get a biopsy done. And I'll tell you what is in the biopsy. If the endomysial antibodies is also negative and HLA is also negative, then I'm having a false positive. Can I say this, yes or no, that I'm having a false positive TTG? TTG is increased, but EMA and HLA is negative. Okay, I'm having false positive, what you called TTG, right? That's what. So yeah, yeah, that's it. And if the endomysial antibodies is negative and HLA is positive, then again biopsy is something I would like to get it done. Like, can we appreciate this point? If one is positive and one is negative, like, don't cram the whole theory. Okay, if both are negative, false positive TTG. Both are positive, confirm celiac disease. One positive, one negative, anyone, then biopsy करवाएंगे, ठीक है, biopsy करवाएंगे. So biopsy करवाएंगे. What will you get in biopsy? Can you please tell me what is the biopsy finding you see in a case of celiac? क्या मिलेगा biopsy के अंदर? What will you see in biopsy? Let me show you. See now. Number one, is upper GI endoscopy useful or not? The options are true or is it useful, true, or is it not useful? Anyone? The answer is, of course, it is true. It will be useful. Is upper GI endoscopy useful? Can we see photographic memory? Can we see this? We are doing this kind of endoscopy in this child. So it will do that. Where should we take the sample? Yeah, very nice question. So we have the various part of duodenum. Like, this is my stomach and then I have my duodenum, right? First part, second part, third part, and then we have the fourth part. So which part, where should we, what you called, take the sample from? Which part of duodenum? What do you think? Which part should I take the sample? So we have various parts of duodenum, right? But if I'm planning to take one biopsy, I'll take from duodenal bulb. वो क्या होता है, sir? What is duodenal bulb? This one, very beautiful photographic memory. Thanks to the slides and everything. Yeah. If I am taking one biopsy, then from duodenal bulb, this part will be enough taking the biopsy. If I'm taking at least, if I'm planning to take the biopsy from the second and third part of duodenum, then at least I'll take 4 biopsy. Can you remember 2, 3, 4? Yes or no? If I'm taking the biopsy from the second and third part of duodenum, then 4 biopsies are required. If I'm planning to take the biopsy from the second and third part of duodenum, 4 biopsies are required, and from the duodenal bulb, only one biopsy is enough. Now, what are we finding? Now, this is the exam question. Can you please tell me, Osama? It's 2 more minutes, then this class is over. What are the findings you will see in a case of celiac disease? What do you think? क्या मिलेगा duodenum में? क्या है ये? क्या चीज़ है? What is this? ये क्या हो रहा है यहाँ पे? Anyone? I'll show you one more picture. Very beautiful slide. What is ये क्या है? What is this? Anyone? This round stuff. What do you call it? I had never seen it before. Exactly. Now this one is known as scalloping of the duodenal folds. Very perfect word we have. Number one, in the duodenum, we will see this scalloping. इसको बोलते हैं scalloping. Very beautiful picture. Please, photographic memory. Allow your brains that I know this one. What is this? Scalloping of the duodenal folds. Number one. Number two, where can I say this, that we have the normal villi, but in a case of celiac disease, villi will damage? Do you remember that? Yes or no? The inflammatory markers, cytokines, and all those inflammatory cells, basically, they're gonna attack on my villi, on my intestine, and in the intestine villi, what are they going to do? They are going to do villus atrophy. Is this line true or is this line false? Definitely it is true, no? We can have a partial atrophy, we can have a subtotal atrophy or total atrophy. That undoubtedly the patient will have a villi खत्म हो जाएंगे, villus atrophy will be there. Are you understanding? I was when will you do endoscopy? When the either the endomycin antibodies or HLA, anything is plus minus, I will do endoscopy. What will you see? See scalloping of the duodenal folds. My villi will be dead, gone. So subtotal or total villus atrophy. And of course, I told you crypt hyperplasia and IEL will increase. Increase in the intraepithelial lymphocytes. This one basically ये पूरा part जो है, so there will be increase in the blue lymphocytes, intraepithelial lymphocytes. This is also very beautiful slide that kind of this one. So there is a increase in the intraepithelial lymphocytes. Remember that, okay? Now, very important exam question. One more minute, then this class is over. The degree of the villus atrophy and number of the intraepithelial leukocytes are based on which classification? Now, this is a very amazing question. Can anyone please answer me? The degree of villus atrophy and number of intraepithelial leukocytes are based on which classification? What is the name of the classification? Arpita, Shagufta, Samir. Okay, the answer is Marsh-Oberhuber classification. Marsh-Oberhuber classification. Very beautiful name. Marsh-Oberhuber classification. Marsh-Oberhuber classification. So if the Marsh-Oberhuber classification is seen in a case of celiac, where do you see Westhaven classification? Anyone? Anyone? Any random guesses? Beautiful class with beautiful points. Anji, jaldi batao. Exactly. Osama? Yes, the answer is acute liver failure. The answer is acute liver failure. Yes, exactly. So Marsh-Oberhuber classification is there in the celiac disease, whereas Westhaven classification is there in acute liver failure. Do you remember acute liver failure or hepatic NCAF? Of course, the patient will go to hepatic NCAF. And how many stages are there of hepatic NCAF? There are 4 stages. 1, 2, 3, 4. There are 4 stages. In which stage of hepatic NCAF you see asterixis? What is asterixis? But I will ask you 1 million questions, okay? Don't say, oh, this is away from the topic and all that. Will this come in exam? What will you write? You must write this, right? Exactly. So there are 4 stages of hepatic encephalopathy, and asterix is nothing but flapping tremors. Do you remember flapping tremors? Put your hands like this, then do like that, then the patient will be like this. So nothing but very importantly, yes, क्या बोलते हैं उसको flapping tremors. And which stage of hepatic NCAF you see flapping tremors? Stage 2 and stage 3, very important. In stage 1 and in stage 4 you don't see what you called exactly, we don't see we don't see what asterixis is not seen in stage 1 and stage 4, whereas in stage 2 and stage 3 you see asterixis, and asterixis and everything is a part of what you called acute liver failure, acute hepatic encephalopathy stages, and the name of the staging is Westhaven classification. Westhaven classification. So Marsh-Oberhuber classification is there in celiac disease, and Westhaven classification is there in acute liver failure. Is everyone understanding this much? Please put a like button to this video. Are you able to understand, yes or no? Exactly. So yes, so these all changes of that villus atrophy, crypt hyperplasia, increase in intraepithelial lymphocytes, they are based on modified Marsh criteria. They are based on modified Marsh criteria. And what is that? This one, can we see very very beautiful picture? See, remember everyone, my dear friends, I don't want you to cram. Don't ratify this, don't cram. Just in general you should know there is a Marsh classification. You see the intraepithelial IEL counts, crypt hyperplasia and villus atrophy. Please, for God's sake, I want you to remember just 3 points, and at least 10 times I have repeated. IEL count will increase, crypt hyperplasia and villus atrophy. So depending, the patient will have a Marsh 0, 1, 2, 3 or Marsh 4. There are Marsh 0 to Marsh 4 classification. Okay. So naturally kind of a, moderate or total, kind of a subtotal total villus atrophy, and increase more than 30, kind of like that. So increase in IEL. So this is a rough thing I want you to remember कि ऐसा Marsh criteria होता है. This is known as a Marsh criteria. Number one, coming back to our important picture, the patient was having symptoms. I plan to get a TTG done. I plan to get a TTG done. TTG is tissue transglutaminase. It was negative. I said there is no celiac. If it was positive, what did I do? I checked how much positive. more than 10 times of normal or less than 10 times of normal? If more than 10 times of normal, I plan to get a endomysial antibodies and HLA, human leukocyte antigen. If both are positive, then of course it is celiac disease. If both are negative, then it's a false positive TTG. If one is positive, one is negative, let's get an endoscopy done, and endoscopy finding we've already seen, right? Now, if the patient is having TTG less than 10 times of normal, then again same drama, get a biopsy, get a upper GI endoscopy and biopsy done, and then level on the Marsh criteria basically. So if you get a Marsh 2 to 3, remember Marsh criteria I showed you 0, 1, 2, 3, 4. So if anyone having Marsh 2 to 3, दिख रहा है ना मेरा चेहरा तो नहीं अड़ रहा. So if a patient having Marsh 2 to 3, confirmed I'm having celiac disease. If the patient is having Marsh 0 to 1, then it's a potential case of celiac disease. Very beautiful slide, perfect picture, remember that. Okay, next important point, diagnosis of a celiac disease in asymptomatic patient. That was symptomatic patient. The patient had come with symptoms. The first investigation I got it was TTG, tissue transglutaminase. This is the asymptomatic. Suddenly some skin problem came and I am thinking it's a asymptomatic. Let's just rule out celiac. Then number one, in that case, I'll get a HLA done. HLA-DQ2, HLA-DQ8. If it is positive, naturally, then I have to get a TTG done, tissue transglutaminase level. So can we appreciate one, can we connect one point? If the patient was having symptoms, directly I got a TTG done. If the patient was not having symptoms, I got a HLA-DQ2 and DQ8 done. And then if it was positive, then I got TTG done. Okay? And in that case, if I got a TTG done, then again depends, TTG is more than 3 times of normal or less than 3 times of normal. If the TTG is more than 3 times of normal, I will get a biopsy done. And again in biopsy, same, March 2 to 3 is there, then it is confirmed. And if March 0 to 1 is there, it might be a case of celiac disease. And that's it. If the TTG is less than 3 times of normal, then I'll get an endomysial antibody done. Okay, that's it. So this is roughly, I want you to get a little idea of how things, kind of show in a case of asymptomatic patient. Asymptomatic patient, the first investigation is HLA-DQ2, DQ8. In symptomatic patient, the first investigation is TTG, transglutaminase. And if you do a HLA-DQ2, DQ8, if it is positive, then you get TTG done. And if इसमें क्या है, more than 3 times, less than 3 times. और उसमें symptoms वाले में क्या था, more than 10 times, less than 10 times. Here it is more than 3 times, less than 3 times. More than 3 times, get a biopsy done, and less than 3 times, get a endomysial antibody done. कहाँ चला गया? Endomysial antibody done. Finish. Next point. That's it. So this part is over. Let's come to the what do you call, treatment of this one. This everything we have covered treatment. Exactly. Let's finish this class. So gluten-free diet. Everyone knows, yes or no? Can I give a gluten-free diet? Gluten-free diet is the only and only cornerstone, the most important treatment in a case of celiac disease, right? So now the last question is, एग्जैक्टली दीपक कह रहा है एसिम्टोमेटिक देन वाई कमिंग टू डॉक्टर एंड आने के बाद इतनी कॉस्टली इन्वेस्टिगेशन कौन कराएगा? उस पेशेंट का अगर मेडिक मैक्स बूपा का या किसी का मेडिक्लेम हुआ ना, तो लाखों के बिल तो ऐसे ही आते हैं. तो यूजली डॉक्टर का रिस्पॉन्सिबिलिटी होता है टू गेट ऑल द इन्वेस्टिगेशन डन. देयर वाज अ रीसेंट मेडिको लीगल केस दैट द पेशेंट सेड दैट all investigation doctor did not do in my case, only some investigation done. So you to have the benefit of doubt, do all the investigation in private if the patient has a LIC policy or something like that. If the patient is very poor from very government background, like in a government medical college, very poor patient, then so of course every single penny counts and get the relevant investigations done. Exactly. So what is allowed? Number one, can the patient have pure oats and maize? क्या patient oats खा सकता है, maize खा सकता है? The answer is yes. The only thing allowed, definitely pure oats is allowed. Okay, pure oats is allowed. Very, very important. Pure oats is allowed. Chapati, rice, jawar, wheat, barley, is this allowed or it is not allowed? So chapati, rice, jawar, wheat, all those things are not allowed. They are not allowed. Remember that. And what is wheat and what is barley? Can you please tell me what is wheat and what is barley? गेहूं तो wheat हो गया, barley क्या होता है? I don't know. I'm going to show you a picture. Very beautiful picture. One is barley and one is wheat. This is oats and this is rye. Very beautiful slide. This is wheat and this is barley. Still photographically you're not able to connect. Then what is wheat, what is barley? Wheat is without the cover. The wheat, no, wheat, ye wala. इसको बिना छिले वाला होता है, विदाउट, हाँ, विदाउट द कवर, यस, छिला हुआ मतलब छिला हुआ होता है। एंड बार्ले इज विद द कवर, बार्ले इज विद द कवर, ओके। Yes, and wheat is without the cover. That's the difference between wheat and barley, and that's they are not allowed. What about mustard? Very nice question. Can you please tell me mustard is allowed or mustard is not allowed? Who will tell me? Allowed or not allowed? What do you think? So yes, exactly. The best answer is mustard and sarson. Definitely, we have various types of mustard. Basically, yellow mustard, black mustard. Mustard and sarson is definitely allowed. So pure oats allowed, mustard allowed, and mustard is nothing but sarso only in Hindi, and that is allowed. That is allowed. Mustard, sarso allowed, pure oats allowed. That's it. And jawar, sorghum, barley basically is not allowed. ज्वार इनका दूसरी इनके अलग अलग नाम है, ये बार्ले, जवार और सोरगम, दैट मतलब रिमेंबर वन थिंग लाइक बार्ले एंड जौ इज नॉट अलाउड, यूजली जवार इज डिफरेंट, जवार इज अलाउड, jawar is allowed, pure oats is allowed, very importantly. And this one mustard sarso is very important, this came in exam. Mustard sarso allowed, jawar sorghum allowed, barley is not allowed, and pure oats is allowed. This is what you need to know. That's it. That finishes this session. Thank you so much everyone for this wonderful participation. And before leaving, we have this amazing quote that if the world was blind, if the world was blind, how many people would you impress? If the world was blind, if the world was totally blind, then how many people would you impress? How many, Deepak, how many will you impress? The answer will be zero. You will not impress anyone. So that's what. So live a life like that. Don't impress people, only express, no impress. Be what you are, tell what you are, and that's it, no problem. Okay, that's what. So if the world was blind, how many people would you impress? The answer is zero, and that's what how you should live your life. Don't impress people, just be yourself, be amazing. Okay, the next topic, tomorrow evening we have a class. Tomorrow evening we have a class 6:30 p.m. on the growth and development. Today also we had a beautiful class on growth and development, and tomorrow also 6:30 p.m. on the Unacademy app. On the Unacademy app we have of what you call beautiful class and 6:30 p.m. on growth and development. Then again late night only around 9 or 9 p. I'll let you know the timings, but then also we're gonna have a YouTube class also. So see you tomorrow evening 6:30 p.m. on our Unacademy channel on growth and development part 2. Growth and development part 2. Thank you so much abhi bhi all. Yes, Dipanji sir सारी करवानी है investigation. That's it. Thank you so much everyone for this wonderful participation. I hope you have understood the topic, and remember, if you can stay positive in a negative situation, you win. You definitely win. Thank you so much, and do share, like, subscribe. I hope you had a good time, and I'll also take rest now, and shave करा के आया हूँ मैं ताकि कल सब सेट रहे. ठीक है. Bye bye. Take care. See you. Tomorrow come, okay? कितने बजे? 6:30. The link is already there on the Unacademy app. Just come. ऐसे आंख बंद करके आ जाओ.